Ever feel like Epic EHR is slowing you down instead of helping? You're not alone. A survey from AMIA shows that 44% of healthcare providers struggle with EHR inefficiencies. But here's the good news. Epic EHR can be optimized to work for you, not against you. Today, we're breaking down how to make Epic EHR faster, smarter, and way more efficient. Hey everyone, welcome back to OSP. We're diving into Epic EHR optimization today. Because let's be honest, a poorly configured EHR can be a nightmare. It slows down workflows, increases documentation time, and adds to clinician fatigue. But here's the thing, when optimized properly, Epic can actually save time, improve workflows, and even reduce burnout. In fact, a study published in JAMA Internal Medicine found that physicians who adopted team-based documentation approaches experienced a 9.1% decrease in documentation time and a 6% increase in weekly visit volume. So let's talk about how you can get there. Step 1. What is Epic EHR optimization and why it matters? So what exactly is Epic EHR optimization? Simple. It's customizing and fine-tuning Epic to fit your organization's needs. It's not just about tweaking a few settings. It's about fixing inefficiencies, automating workflows, and making the system intuitive for providers. Here's why this matters. Better patient care, because documentation happens in real time without delays. Less administrative burden, meaning less clicking and more efficiency. Smarter billing and claims management, which means fewer denials and better reimbursements. According to Deloitte's 2025 U.S. Healthcare Outlook, migrating core technologies such as EHRs to cloud platforms can improve operations, efficiencies, and care delivery. That's a huge impact. Step 2. Process of Epic EHR optimization. Now that we know why Epic EHR optimization is important, let's break down the process of getting it right. Here are the 5 key steps. Assessment and user feedback. Before making any changes, you need to identify pain points. Are providers spending too much time on documentation? Are billing errors causing delays? Conduct user surveys and workflow assessments to pinpoint exactly where Epic needs improvement. Customization and configuration. Epic isn't one size fits all. Optimizing means customizing templates, workflows, and dashboards to match your organization's needs. Role-based dashboards, streamlined data entry forms, and automated order sets can dramatically improve efficiency. Automation and AI integration. Next, bring in automation. Voice recognition tools, AI-powered documentation, and predictive analytics can reduce clinician workload by up to 40–50%. AI-driven alerts also help reduce medication errors and enhance decision-making. Training and adoption. No optimization is effective if your team isn't trained properly. Providers should receive ongoing Epic EHR training to ensure they fully understand new features and workflow changes. A well-trained EHR users complete tasks much faster indeed. Continuous monitoring and improvement. Optimization isn't a one-time task, it's an ongoing process. Regular system audits, user feedback loops, and performance tracking are essential to keep Epic running smoothly. Organizations that continuously monitor their EHR workflows see a great reduction in errors and downtime. So, if you're optimizing Epic EHR, follow these 5 steps. Assess, customize, automate, train, and continuously improve. Step 3. How Epic EHR optimization maximizes efficiency. Let's get into the real impact of Epic optimization. This isn't just about convenience, it's about saving time and making workflows seamless. At OSP, we have optimized Epic for many clients, and here are our observations. Customizing workflows. Pre-built templates can save providers 2 to 3 hours per shift. Cleaner user interfaces. A role-based UI setup reduces navigation time by 25%. AI-powered voice documentation. Tools like Dragon Medical reduce typing time by 40%. Goodbye keyboard fatigue. Automated medication orders. Reduces errors by 50% and speeds up prescribing. Predictive analytics in Epic helps identify high-risk patients, reducing readmissions by 15%. That's not just small improvements. These optimizations directly impact provider productivity and patient safety. Step 4. Workflow optimization for better efficiency. Now, if you really want to maximize efficiency, you need to optimize workflows. Here's what makes the biggest impact. Automated scheduling, less admin work, fewer scheduling errors. Voice assistance for documentation, no more endless typing, real-time note-taking with AI. Real-time charting, no more catching up on notes after shifts. Billing and coding automation reduces claim rejections, increases revenue cycle efficiency. Hospitals that optimize their workflows see a 20% boost in efficiency, and that's without adding more staff. All right, let's wrap this up. Optimizing your Epic EHR isn't just about making small changes. It's about creating a system that actually works for you. Here's the key takeaway. Customize workflows and UI to make Epic easier to use. Leverage automation and AI to cut down documentation time. Use time-saving features like smart forms and voice commands to reduce workload. Optimize workflows for efficiency and reduce provider burnout. Want to make Epic work better for your organization? Our experienced Epic optimization experts will surely offer the best solution. Visit our website osplabs.com for detailed information. Tell us in the comments, what's been your biggest challenge with Epic EHR? We'd love to hear. For more health tech insights, don't forget to like, subscribe, and hit the bell icon so you never miss an update.